Good afternoon, everybody. Thank you so much for joining us today on the Dade County Weekly Update. My name is Carey Anderson, and I do communications for Dade County. Remember that you can type your questions in the comment section during the live update. If you don't want to ask your question during the live broadcast, you can always email us at info@dadecounty-ga.gov. Thank you so much for coming to the right place for the right information. Today, we'll be hearing from Alex Case, who is our Director of EMA here in Dade County. He will be giving us an update on the vaccine, the COVID vaccine, and the procedures for that. We will also be hearing from Robert Goff, who is our commissioner and one of our commissioners and vice chair for Dade County. If you know someone who would be interested in hearing from any of our guests today, go ahead and invite them to watch this live broadcast or start a watch party so you can hold your own discussion. Remember that you can also watch this later on Facebook or YouTube, and sharing the links to our videos is super easy. We do have a reminder that tonight is the commission meeting. You can see a copy of the agenda online at dadecounty-ga.gov on our calendar. You just click on the agenda that's attached to that. You can see that. We are asking that you watch that from home if at all possible. You are more than welcome to come here. It is an open meeting. We have space for about 10 people set up here in the commission meeting room. But due to COVID procedures, we are asking if you can watch from home. The lobby to the tax commissioner's office is currently closed due to a COVID exposure, but the walk-up window is open. So the walk-up window that we installed earlier in the year, or last year actually, in 2020, is open. So we do have lots of questions about the new COVID vaccine. So Commissioner Goff and EMA Director Alex Case will be talking about that in today's update. Unfortunately, the Department of Health couldn't send a representative because they are just covered up doing their jobs down there. So we want to give them a shout out. Thank you so much for all you do to all of our healthcare workers. Thank you so much. At this time, we'll hear from Mr. Case.
Thank you, Carey. And again, I'm Alex Case, Director of Dade County Emergency Services, and we know the vaccine is coming into our public health, our Dade County Health Department downstairs. It started coming in week before last. We met with them. Firstly, the first group of people that received this, they're bringing them out in phases, was the healthcare workers in most of your hospitals and where the sick individuals are at right now to protect them. And then it also moved into EMS, Emergency Medical Services. That is our EMTs, our paramedics, and our first responders that go out and help someone that's sick. Nearly every call that we take into the 911 center, we ask a standard COVID question that Dade, Walker, and Catoosa come up with our medical directors to help protect the individuals going out. These questions that we ask after we get their initial complaint, we dispatch the ambulance and the first responders, then we start asking these questions. More and more questions that I see in the Q&As that we do, somebody has either been in contact or has had the virus. Again, a lot of folks are recovering from this, but we have to treat a lot of these calls with precaution. Our sheriff's office, our police department, our public works, our workers that come into the county facilities here, the courts facility, as Carey mentioned, the exposure issues we've had both in administration office and currently in the tax commissioner's office. It's just something that we have to take day to day, and we're working with to make still things available for the county. So there was a very limited amount of vaccine that was sent to the public health here in the building, and we got that list together, got scheduled with that. This vaccine is a two-part vaccine. It's the Moderna. This vaccine comes to public health frozen in a vial. The procedures to get that frozen vaccine is a time amount that when they take it out of the freezer and they set it on the counter to start its thawing process takes 1 hour. And then halfway through that, they have to stir it or shake it really simple by just a swivel motion. Then after that other 30 minutes is up to the equal of 1 hour, we're hoping the first patient is there. And then there is a 6-hour window to give 10 doses of that vial. So Of the folks that we had got through all public safety, volunteer fire departments, the Trenton Police Department, Dade County Sheriff's Office, and Dade County Jail, we've worked through all those people that the first phase was. Now, starting up, they're going to start doing the 65 and older. Now, these appointments are going to have to be called into the Dade County Health Department. And that number is 706-657-4213. And these will be done on appointment. We're hearing a lot of times that people are calling in and getting busy signals or not answering their phone. The current Dade County staff, there's 2 nurses and a nurse manager and a receptionist, so that's 4 people. The nurses are really tied down with vaccines and other things that's coming in, and you have 2 other ladies that's trying to answer the phones, and they're doing the very best they can. So we're asking that you be very patient with this. Even today and yesterday, we've had a lot of hateful comments on the phone to these ladies, or 2 of the ladies. There's been threatening voicemails left on the phone system. We do have caller ID. We will be looking into this. We ask that you just be patient with the limited staff that they have. Again, 2 people answering their phones, trying to make the appointments, and then get to the appointments, in whatever office work is happening at the time. Again, you must be a Dade County resident. You can make this appointment if you and your spouse are 65 and older, and any other person over 65 that's in that same household or caretaker for. You cannot make multiple appointments for your family, your nieces and your nephews, or brothers and sisters of the same age around. They have to call in individually. Again, this vaccine, when you take this shot, you have a window that you have to sit there to make sure that any side effects or things that they will go over with, and then again, they schedule the next person. Don't make an appointment if you've had any vaccines in the last 14 days, any other type of vaccine that you've had, or if you've tested positive for COVID-19, you have to be at least 90 days past your cleared symptoms. Again, if you have had COVID-19 and you've tested positive, you've been sick, you've cleared from the signs and symptoms, you have to be 90 days free of COVID-19. Again, the reason of this, because it will not help your system. We have 10 shots to give in a 6-hour window, and the time restraints that these 2 nurses have is why these things are very important. If you call and make an appointment, you please try to be here. The reason why they're so precise about this, we do not want to waste this. Once that vaccine is unthawed from frozen to thawed out, it cannot be refrozen back. It's wasted. So we're really going to be precise, and they will call and call and call, and they are working with alternate people that's possibly close by, so please try to keep your appointment. If you've made your appointment, try to be here 5 minutes early. You need to assure you can social distance, wear your mask. There's limited seating in the health department lobby. When you approach the Dade County Administration Building, which is in the lower section of our building, or the first level, when you come in the lobby, the health department is on the right. There's sanitation station right there as you come in the door. Have your mask on, and then we ask that you wait in the lobby for 15 minutes. Again, there's hopefully vaccines for our whole population. That's what is coming. There's just limited amount coming in daily and weekly based on the results of how many shots are given today. They turn that in, the state ships more up. There's only amount of storage space, freezers, the amount of freezer space that's limited downstairs as well. So we really ask that your patients let our 65 and older get these, and just be patient with the phones. We've heard a lot of calls about not being able to get in. With the two ladies that's taking these phones, they're doing the very best they can. They're local ladies, great ladies, and they're working really hard. They do have someone else that is retired from public health that's going to come back in and help answer the phones, I believe, tomorrow when I spoke to them at lunch. So this is a big step for our community and for our state and our nation on these vaccines. We've heard what the news has been putting out about what's happening in Hamilton County with they're getting there so long and they're out at the time. And again, the biggest thing is a space to store that much vaccine. So it's having to come in as different things. As the state gets more and more in from the manufacturers, they distribute it to the districts, then the districts to the local county offices. And we please ask you to be very patient with the ladies and be understanding. We do have cameras and we have emergency buttons downstairs. We've had instances where people do come in and be very vulgar or could be threatening to the staff, and they have a direct line or a buzzer to 911, which is upstairs, and we've had to call folks there before in the past. But it's just for the safety. They're doing the very best that they can. They want to be safe to continue treating their county. Again, these nurses are county residents. These workers are county residents, these four ladies, and they love their county. They're here protecting the public and doing the very best they can. So again, that number is 706-657-4213. And, we're still seeing higher numbers come in every day from the list that's given to us for alerts that we put out in 911 for any of our responders, law enforcement. That has continued to spike after the holidays and New Year's. Hopefully that will start ramping back down, but please take your time, get your vaccine, and they are still going to try to hold, I believe, the Wednesday testing days drive-through. Again, be patient with that. I think last week there was 132 folks that drove through that. We've been trying to go down and help them get set up, and with it getting colder and colder, keeping it heated, if you can imagine being out there in the shade, 9 hours a day doing that. So we're trying to make it just as easy as possible. Again, it's those two nurses and one tech out there. Of those four, that leaves one person in the office to answer the phones on the Wednesdays. So again, these ladies are working very hard with their limited resources. And if you know them, thank them. Again, they love their county and what they do. And please continue to do your social distancing. We're taking a lot of extra steps in, and when I'm out, I see people standing back and keeping their mask on. And we really appreciate it. And thanks for everything you do. And if there's any other things needed, please get us on our information, and we'll be glad to help out what we can. Thank you.
Thank you, Alex, for that report. And before I get started with mine, something that I thought of while you were talking. Before we started actually getting the vaccine, there were people that were wanting tested. More and more people being tested, either the drive-through testing on Wednesday or the rapid testing. And it didn't really dawn on me until there's still people going to be wanting both of those things, and that just increases their workload with the vaccine coming in. So please, you heard everything. You may hear parts of it again now and tonight if you listen to our meeting. But those ladies down there, there's only so much that can be done. The vaccine's been developed in about 9 months, much quicker than anyone in the world probably thought it would. So they do not they do not deserve being talked to terrible, vulgar, or threatened in any way. They're only doing a job. And the vaccine will continue to come in, and right now it's going to those who are, no one's in more need of it than another, except for the fact that you're more in a vulnerable state. So please take what Alex said and tell people if they're going to come to be sure to call, because I'll just be honest, first hearing about this, and I was with a person this morning and got a call that they had tried to call and right off the bat, I thought, well, That's not the way it should be. It shouldn't be done that way. But then come to find out, I never stopped to think, to do the math, that if you've got the idea of making that phone call, there's hundreds of others perhaps at the same time that are wanting to get that vaccine, whether they're 69 and older or whatever. And there's only so many calls that can come in, and maybe those that get it are just lucky enough to be on that little cusp of when that last call was over and the phone was laid down. So please take what you've heard and realize it is that the best we can do is being done. It will be rolled out, I think, to drugstores and everything in due time, and there will be more places to receive the vaccine. But right now, Dade County, Hamilton County, all the places we hear about, they're doing the very best that they can do. And we've, like I say, we would have expected to be years away from this point, but because of Operation Warp Speed, the United States, the federal government, this vaccine has been developed, and now our prayer is that it works and does the job that it was developed to do. And I have no reason to think or believe that it wasn't. So I'll get on to mine now. The first thing I'll talk about today, and it's something that you've heard, and it's County Road 6, but I've been asked about that a couple of times actually in this week. First, before I get to that, I do want to give an update on our county executive, Ted Rumley, and the reason that he's not here. Ted tested positive. Most people know that by now. If you've looked on our website, talked to neighbors and friends, Ted tested positive a week from this past Saturday. So he's about 13, 14 days into. He had a pretty bad case of it. Has not been hospitalized. He has been at home the whole time, but a lot of his has been low-grade fever. It's been mostly just giving out, just no strength. His oxygen level has stayed pretty good and is still good, and that is one of the factors that is watched for everyone because that can affect the oxygen level, but it's staying up. His wife, as you know, Diane, tested positive, and talked to him just a little bit before I came over here. Her words were, Ted's a little better, I'm a little worse. Keep them in your prayers, and hopefully in the next week and a half, Ted will be able to come back in at least on a limited schedules, part of a day or 1 or 2 days a week. We don't know when that'll happen, but we want to keep everybody as safe as we can, so keep them in your prayers. It's a real thing. The virus is real. Attended a funeral yesterday of a true COVID patient, COVID death, that just happened to be my wife's only living brother. So he developed it about 3 weeks ago, passed away in the hospital or in hospice. So it is a real thing, and it touches people. And, of course, some people never know. They're asymptomatic. They're walking around with it. They don't know it. Others, it may be as simple as a little congestion and everything else. But if you have a reason to be tested for the test, again, this brings that same phone number in. We'll get to that in a moment. But you have to make an appointment to get that rapid test, and you have to meet the criteria to get it. If you go in and say, no, I haven't had any symptoms, I just want to be tested, they're not going to test you for it because they're only testing people that have a couple of those symptoms, and they're varied. The one that both Ted and Diane lost their sense of smell, their sense of taste, and then a little low-grade fever. Those would be 2 of them. Just the flu-like symptoms, body aches and pains and all that. So, but they will not give you the rapid test. Now, the one on Wednesday you can drive through and get from 9 till noon, or 9:30 till noon, and then in the afternoon, 12:30 to 4 o'clock. So, do want to talk about County Road 6, getting back to that. We've been talking about it a long time, and I asked Carey this morning when we were at the TV station, I said, have you been out there? She said, no, I have not. So Carey Anderson, who does a great job on keeping the county up to date on the webpage, we went out, were able to get some pictures. She has not posted them yet, but we just wanted people, I said, I want people to see the scope of what we're doing. It's not putting down a little bit of asphalt. I can stand here all day and it's like a banana pudding. I can tell you how good it is, but you won't know till you taste it. I can tell you how bad that road was, but you wouldn't know till you see it. But there were places where the old asphalt was over 3 feet thick, that over the years, year after year after year after year, and Billy Massengale, our road department, has only put down the last 2 layers of that, the last 4 to 6 inches of that. So over the years, it's just been being patched, more asphalt, continuing to slide. But when Carey can get these on, I want you to stay tuned for them to go on. It may not be today, hopefully tomorrow. You get an idea of the scope of that. So right now, you're thinking, how long does it take to pave a road? There is a one lane of that road that is dug out, probably close to 6 foot deep. It is 450 approximately, 350 approximately, that first dig, phase one, or step one. And then you've got all the rebar to put up. There's piles in there, where they've driven the piles in, 40 foot underground, cemented in. That's what it takes to finally fix it, so it's not your ordinary fix. You want to know a time? I can't give you. Last I asked Billy the other day, it will not, I don't think, and this is all, we're at the time of year right now, we have to say weather permitting. Today's a great day, even though it's cold. You can do all kind of work today. But weather permitting, it will not be done, I'm sure, before the end of February or maybe sometime in March. Because it is such an extensive job that nobody would ever imagine when you just say fixing a road. It's much more than the ordinary fix. The Department of Driver Services 2021 schedule is online at Dade County -ga.gov. And the dates here are January the 11th, January the 25th, February the 8th, and February the 22nd. So if your license are expiring, and that kind of thing, and you want to come in and get them done, those are the dates. And again, they're posted on our website. Departments that are closed, we talked about last week. The sheriff's lobby is closed. The Dade County Sheriff's office, lobby will be closed, and fingerprinting suspended until further notice. We do have a number for you to call. It's 706-657-3233. If you have a question, maybe guidance to where can I go, I really need to get something done. But we can't say we're being as safe as we can and not let the people take the initiative if they feel like they need to close their lobbies or whatever. That brings us to one that Carey already mentioned in the very beginning. The lobby to the tax commissioner's office is currently closed due to COVID exposure. But the walk-in window, those are, as you walk up to the building, you've got the election commission on one side, the tax commissioner's office on the other side, and they both have windows outside that you can still do business through those windows. But there's a little caveat to that. Coming up January the 13th through the 18th, and we've been reporting on this for some time, the Georgia Department of Revenue Motor Vehicle Division is upgrading a new version of Georgia Drives, in other words, computer system, for title and vehicle registration services. Now, what this means to us here in Dade County and all over the state is that between the January the 13th and the 18th at least, you will not be able to get your tags, and you will not be able to get a title on a vehicle because they have no way of putting that into the computer and everything that it takes to get it. So keep that in mind. If your tag's about to expire, your birthday is coming up, you only have a couple of days really after tomorrow, and then you'll have a couple of days on next week, Monday and Tuesday. But on Wednesday, you will not be able to do that. Or if you buy a car, sell a car, or whatever, they won't be able to do anything with a title on that. So keep that in mind, and we just have to kind of go with the flow sometime. This is not COVID related, but it's just something that the state has to do, and they're doing it from the middle of a week for 5 days, and it may take more. I don't know. I couldn't tell you it'll take more or less. Hopefully the 5 days will take care of it, and that's 13th through the 18th, so that would be Wednesday through Sunday maybe, and hopefully they have it done. All right, the county offices are open. Everyone is in there at work today. We do have the new wall that's put up. We said if you go in, it's the same room you've been going in. It's the same door you'll open. But we have put up a glass enclosure like you see in a lot of places. If you've been in the courthouse around the deputy that sits there and the security that sits there, and you have to walk through the security, then they've got glass in front of them. So we've done that. Again, this is all because of the COVID money that was given through the CARES Act in the beginning allowed us to be able to do all this stuff to try to keep down the spread of. Will it go away if they ever say the virus is over? No, because we never know, and it's the right thing to do. It's just more security for people maybe that are working there, but it's certainly more security in the time of a pandemic of any kind. The election secretary for elections, I hope that nobody has to do this as far as the runoff for the state or U.S. Senate offices. Yesterday, as well as our public service commissioner race was settled, we hope, and there's 50% happy people and 50% sad people. Pretty much the way to put it. It was almost down the line 50-50, 49 to 51 and whatever, and Mr. Ossoff and Mr. Warnock both won, so the state of Georgia, as far as the U.S. Senate, did go blue. We're no longer a red state. As you know, those are 6-year terms. Not everybody, the House of Representatives 2, Senate is 6, and then the governor races and so on are 4 years, but that will be our senators for the next 4 years, or 6 years, and we hope that they do a good job for all people of Georgia. They promised that, and until anyone proves different by their actions, then let's not be critical, let's not fight and squabble over it, because the election's done, people spoke, and that's that. Tonight at 6 o'clock, here where we stand in the commission room, we'll have our commission meeting. It starts at 6 o'clock for the work session, where we consider items on the agenda. Carey has already said you can see the agenda on our webpage if you want to see what's coming up tonight. But it is a very limited number of seats that we have, because, again, we're doing everything we can to limit the spread. We're wearing masks when we're face-to-face, close to each other. We're trying our best to do social distancing. So hopefully in the next couple of months, with the vaccine rollout and all this, we'll be able to go back to more normalcy and put more chairs in here, and people can come back, and we can do much better. We hope 2021 brings many, many changes in that regard at least. The first case, and this is something that I guess we all dreaded to hear, but the first case of the COVID-19 variant has been identified in the state of Georgia this week. This variant is not thought to be any more dangerous, and we've heard that from the governor, and we've heard it also from the federal government, because it has already been found in the UK and in a case or two here or there. It's not thought to be any more dangerous, but it is thought to be easier to spread. So therefore, the welcome of the vaccine is even more welcome because of that, so it could be more contagious, but not any more dangerous than whatever we have. Now, those two go hand in hand like a hand in a glove. If it's easier to get it, then obviously it could make the numbers grow. We're going to get to some numbers in a little bit. COVID testing and info, I did run across, again, it's the same number that Alex gave. It's the only number we can give you for the Department of Health downstairs for COVID testing and information. Excuse me, it's 706-657-4213. That's 706-657-4213. The vaccine, he covered a lot of that, but it is available, and as of last Friday, the governor added 65 plus years to it. So if you're in that age group, I can tell you now, if you call and there's no other, you're not a healthcare person, you're not a responder, or, some people in that first wave, and you're not 65 or older, then you're not going to get it either. So please be patient. As Tammy said on the little talking points you give us, that there will be plenty of vaccine for everyone at some point. So please be patient. And then the Moderna, it is coming through Pfizer and Moderna, the vaccines. And, after this first wave, as you get the first one, there's still yet another shot. I do know, I was sitting with a person today who got through and made an appointment themselves. Today, their appointment to get a shot now is not until the 21st. So it's still another week away, over a week away, before they will be able to get that shot, because, as Alex said, there's so much vaccine, they're thawing so much, and we don't want to waste it. We all heard the news up in, I think, Wisconsin or somewhere this week, and it's finally come out, the best I heard, the last I read about that incident, that the guy did it on purpose because he didn't trust it. Now, this was a healthcare person, but what he had done, took 50 vials of that out and just let it thaw out and go to waste. that represented 500 people not getting a vaccine. So that is the reason it's so important to follow the guidelines that Tammy gave Alex gave to you, is if you make that appointment, do everything in your power to keep that appointment, and they will try to get a hold of someone else to come in, maybe that's called and waiting, because if it goes bad, it will benefit no one. The drive-through testing is still available Wednesdays from 9 until noon and 12:30 until 4:30 in the afternoon. Rapid testing, we said, rapid COVID testing is free for any person with symptoms. You must have symptoms to get the rapid test. And you must call the number 706-657-4213, the health department, to be screened for symptoms, and they will be given an appointment time and testing instructions. And this again is for the rapid COVID testing. There are other occasions. If you can't, maybe you could go, but we're doing this for the people of Dade County. They're probably doing it for the people of Catoosa County, but in the Catoosa County Health Department, Monday, Tuesday, and Wednesday from 9 a.m. till 12:30 till 4:30, and at Mount Zion Baptist Church in Lafayette from 9 o'clock until 12, and 12:30 till 4:30. So I know that's a lot of information to take in. A lot of it you heard if you listen to this every week, and you listen to the Thursday morning TV program, then you've probably heard a lot of this. But we want to make sure people know it is important to know, and the more you hear it, the better informed you can be. I'm going to give right now the numbers, and it's a full page of numbers, but they are important to us. But Georgia has at this time 602,796 confirmed cases, and that is up from 558,177 last updated on 12/30. So there has been an increase. Dade County has 773, 708, up 708, 90 in the last 2 weeks. We have still recorded 7 deaths. There are 38 hospitalizations. Walker County has 4,079 cases, up from 3,743, so it's up 524 in the last 2 weeks. Catoosa County has 3,510, up from 3,185, 485 cases in the last 2 weeks. Now, bear in mind, more people as we go are being tested. Therefore, these numbers will be found to go up. In 1,000 in Chattooga County, 1,616, up from 1,513. That's 172 cases since the last report. Whitfield County is a much higher county than us. They have 11,368, up from 10,690, and that is an increase of 1,263 in the last 2 weeks. Gordon County, has a total number of 4,298, up from 4,022, so 417 over the last 2 weeks. Floyd County has 7,132, up from 76, and they have 752 in the last 2 weeks. There are 3,206 unknown in the counties. Remember, there's 159 counties in the state of Georgia. The deaths are up. The deaths are at 10,035, up from 9,808. Hospitalizations across Georgia now are 43,629. Since yesterday in the state of Georgia, we've had 5,671 cases, 70 deaths, and 611 hospitalizations. In Tennessee, important to us because many people have to go there for different reasons, but they have 625,237 confirmed cases, that up 7,588, and then Hamilton County, which Chattanooga, has 30,853, and that is up from 28,127. They do give the recovered. They have active cases of 3,000, 995. They have 26,573 have recovered, and they have 285 deaths. Marion County, Jasper, has 2,007 cases, and they are up from 1839. They are 245 active cases, 1,736 have recovered, but 26 deceased. Grundy County, out on Mont Eagle Mountain, 1,289 cases, up from 1,186. They have 138 active cases and 1,131 recovered, with 20 deceased. Sequatchie County, Dunlap, and in that area, 1,230 cases, up from 1,140. They have 134 active cases, 1,079 have recovered, 17 deaths. In Bradley County, which is Cleveland, 9,721 cases, up from 8,994. They have active 1,083 cases, 8,557 have recovered, 81 deceased. There's 3,332 hospitalized, 71 since yesterday. Now that is in all those Tennessee counties. 7,381 deaths, up from 6,810, and that is an increase of 114 deaths in those counties. Alabama has 384,184 confirmed cases, up from 361,226. Then Jackson County, our neighbors, both Jackson and DeKalb. Jackson is 5,420, up from 5,097, 34 deceased, and have an increase of 647 cases in the last 14 days. And finally, in DeKalb County, 7,169 cases, up from 6,690. They have 62 deceased in that county, 611 cases in the last 14 days or 2 weeks. And then the only thing else is confirmed cases global cases, and this is from, I think, the Johns Hopkins University. They, in the whole world, 87,541,542 global deaths, 1,879,952. In the United States of America, there are 21,354,027 cases, with 362,037 deaths in the United States of America. Folks, that is a lot, but thank God for the virus. Thank God for the numbers that we read have recovered being much higher than any other number that we read. And because the global total recovered is 48,938,389. So people are recovering from it. Some are, as I said, some are going through much harder times with it. And there are people that are dying from this. It's a real thing. And we just hope that everybody takes the precaution you can, and everybody stays safe, and everybody stays healthy. Okay. So I'm going to turn it back over to Carey. She's got an announcement. Remember our commission meeting tonight, starting at 6 o'clock for the work session. Then we go directly from it. We take a little break in between, so we don't ever know exactly when the commission meeting will start, but it a lot of time depends on the length of the agenda for the work session and so on. But sometime before or around 7 o'clock, the actual commission meeting. Limited space, so you'd have to get here pretty quick to be in one of these chairs. But do watch it. You can watch it. It's streamed. It'll be streamed on Evan Stone and his station, K-Win. Also, you can watch it on so many avenues now to see it without having to get out and actually be here, and you're going to get the very same information like you're getting it right now. So thank you. Everybody stay safe. Do everything you can to stay safe and keep those around you safe. May God bless you. God bless Dade County. God bless Georgia. And God bless the United States. God bless this global world.
One of the announcements that I had was just brought out to us by Dade County Clerk Don Townsend. They have decided to limit public access to tonight's meeting to 10 people, so it will be capped at the first 10 people who come in. Commissioner Goff, thank you so much for mentioning the live feeds that we will have tonight. A lot of people have questions about those live feeds. They are not broken. Once they start, they don't stop. They're not edited. They are not paused. They are live feeds. KWIN provides that. We do share that to our Facebook page so you can see it if you don't have access to itvchattanooga.com, which is where KWIN shares that, or if you don't have access to see it on their station. I also wanted to address a concern that was shared with us in our feed before we answer questions, and we do have some questions that we'll get to for EMA Director Case, but there was a concern that we were violating HIPAA laws by talking about County Executive Rumley's positive case and his wife, Diane Rumley. We are very, very careful to never, ever discuss a positive case without express consent. County Executive Rumley made the decision very early on. As soon as he tested positive, he consulted some of the commissioners, and they decided very quickly that they were going to go public with that so that they could share that information with you so that you would know some of the symptoms, but so you would also know that we could talk about it, and we put out some press releases about that. We would never violate HIPAA laws here in Dade County. From the beginning of this, you have to remember, we've been working with COVID since March of 2020, and from the very beginning, EMA Director Case, County Executive Rumley, and Nurse Manager, the Department of Public Health Nurse Manager Tammy Franklin made that very abundantly clear that HIPAA was something we had to honor and abide by, so we pride ourselves in that. So please know that we will never violate HIPAA laws. And at this point in time, we do have some questions. We're going to have EMA Director Case back up to answer some of those questions about the vaccine.
Thank you, Carey. One of the questions that come up while we were sitting back here and with our mask on, as we do, as you see, and working on these, is people are asking why the 65 and plus are the next, besides our emergency care, our hospital workers, and our nursing home facilities, our pharmacists. Anything with public health and medicine was in that first level phase, and there was two parts of what they called level one. And these are guidelines from the CDC. And as of last week, 14% of positive cases are 65 to 75 and 85 plus in age. That's how many positive cases. Now, of those cases, 80.9% of them passed. That's how many deaths. So the other 10% of those, or 9.1%, are the surviving of the 14% cases that was of that same week. So our 65 and older folks are our most vulnerable. Commissioner Goff mentioned the new strand that we all read about. It was an 18-year-old male in Georgia. He was home, he was isolated, he was quarantining himself, but it's more contagious. So looking ahead, as we do as planners and talking with some of our public health and reading more, is this going to spread again? You know, I've heard all types of comments like the flu changes every year. Any type of virus can mutate and change. That's just what we see. We see it every year with the flu vaccine. So that is why the 65 and older are very, very important and are the most vulnerable besides the medical care right now until that's done. That's why we emphasize to our older generation to really watch what they're doing. A lot of people that I talk to, their parents at this age are staying home. We bring stuff to them, leave on the porch, get what they need, help them with their medicines, and, you know, mask, wash your hands, social distance. So that was one that we want to spend a little time on, is that of those 14% that was cases positive, 80.9 of those were deaths of that age as well, 65 and up.
80% of all deaths.
All deaths.
All deaths.
Yes.
Not just of those positive cases for seniors.
So all the deaths of that has been of that same age, yeah.
Yes.
Okay. All right, so we got some other questions here Ms. Carey's going to read to us.
So if my spouse is over 65, but I'm not, is he the only one who can get the vaccine?
Well, Nurse Manager Franklin talked about if your spouse or a caregiver of one that's 65 and older, when you call and act that appointment with them, please discuss that. And if you're part of a caregiver that's 65 and older, just discuss that with them. We understand that that will probably be able to happen.
And the last question we have is, if I left a message for the Department of Public Health, should I call back or should I wait for them to call me?
I would call back. Speaking with the department manager, Debbie Atchley, they are on a different phone system. They used to be on the same phone system we had, but since the pandemic, the state put them on their system so they can work from home if they have to and answer other things. They are having some issues with it, of the voicemail getting full so quick. And as Commissioner Goff mentioned, we're scheduling people that has symptoms. We're scheduling vaccines. They don't have time to really go back and get the voicemail, she said. So if you don't get them or you get too busy, please just try to call back and get in line. I know it's aggravating. They know it is. There's hopefully some help coming with that. But we know we do have a lot of the 65 and older, so please just be patient. And as Commissioner Goff mentioned, we're 10 and 11 days out posting for some of these dates. Again, 4 folks, they're working hard. I've been going down on Wednesdays to help them. Last Wednesday I did and seen they needed, and we're just trying to be what we can to help our folks here. So as we have anything else, Ms. Carey? Again, God bless everyone of Dade County and this nation and this state. Please pray and keep everyone in your prayers and thoughts, and everyone that's out there that is fighting this and preparing at home. Our thoughts and prayers are with you. Please visit us tonight at our commission meeting, and you have all of our information at info@Dade or dadecounty-ga.gov, and we're all available to you. So please let us know, and thank you, Dade County.